I am very pleased to join you all for what I am sure is the most unusual ARVO meeting we ever had. Although we missed the opportunity to be together, I am also pleased that this new format allows us to meet at home. We do not even have to travel. Part of our presence here is pre-recorded, and all that will likely allow us to be many more than we were used to. Please be welcome to the annual ARVO Champalimaud lecture. I am so happy to have this opportunity to address you all, wherever you will be listening to us. This last year was a difficult one. While COVID-19 has dominated the headlines, all other diseases have continued to afflict people across the world. This is perhaps particularly true in the area of eye health, where the impact of disease in developing regions can devastate not just individual lives, but also families and whole communities. For Champalimaud Foundation, these times have brought a moment of pause for us to reflect on the rationale of our most important project in this field. When we created the António Champalimaud Vision Award in 2006, it was with the idea of driving both ends of the translational research spectrum, from the bench in the world's most innovative laboratories to the so-called bedside in some of the world's most disadvantaged populations. As we have watched the impact of COVID over the last year, we have seen that it amplifies inequalities. In advanced economies, we were able to access ventilators and medical supplies to improve clinical outcomes. And we now move forward with vaccination programs, which we hope will bring a return to normal life. However, at the same time, communities in many parts of the developing world have yet to properly start vaccination and have been unable to widely offer management of disease. In thinking about inequality, I am more convinced than ever that Champalimaud Foundation made the right decision in creating our award with an emphasis on supporting clinical care in less advantaged populations. The dual focus of our award has allowed us to put 7 million euros into supporting the very best eye care in the developing world. This in addition to the 6 million euros we have given in recognition of the most outstanding eye research worldwide. With this investment, we have striven not only to recognize the worthiest winners of our award, but to contribute to their mission to improve the health and lives of people wherever they may be. Let me briefly name who the past laureates are. On the research side, we recognized the following leaders' laboratories. In 2008, Jeremy Nathans and Qinghua Yao for fundamental discoveries in our understanding of the basic mechanisms of vision transduction. In 2010, Anthony Movshan and William Newsom for their unifying work in the fields of visual perception and visual information processing. In 2012, James Fujimoto, David Wang, Carmen Puliafito, Joel Schumann, and Eric Swenson for development of OCT, and David Williams for his advances in adaptive optics. In 2014, Napoleone Ferrara, Joan Miller, Evangelos Gragudas, Patricia D'Amore, Anthony Adames, George King, and Lloyd Aiello for work leading to anti-VEGF inhibitor therapies. In 2016, John Flanagan, Christine Holt, Carol Mason, and Carl Schatz for their explanation of the formation of the connections between the eye and the brain. And in 2018, Jean Bennett, Albert McGuire, Robin Ali, James Bainbridge, Samuel Jacobson, Bill Hauswilt, and Michael Redman for the successful first use of gene therapy to treat a genetic cause of childhood blindness, a form of Leber congenital amaurosis. On the humanitarian side, the following organizations were recognized. In 2007, the Aravind Eye Care System, an outstanding, sustainable, comprehensive eye care system in India. In 2009, Helen Keller International, a global body organizing worldwide efforts in blindness prevention. In 2011, the African Program for Onchocerciasis Control, a transcontinental multi-stakeholder group working to eliminate river blindness. In 2013, NNJS, Tilganga, EREC, and Lumbini, 4 Nepali institutions successfully eliminated blindness in some of the hardest to reach areas of the world. In 2015, the Kilimanjaro Center for Community Ophthalmology, SIVA and SIVA Canada for the joint action against blindness and poverty across sub-Saharan Africa. And in 2017, Sight Savers and CBM, 2 historic organizations pioneering blindness prevention across the world. I am proud that we could reach communities in many different countries in the world. But we realize that eye health remains a huge area of concern in the way it affects poorer and less developed communities. It is fitting that the last edition of the Champalimaud Vision Award, which was given before the pandemic began, focused on recognizing efforts to offer clinical services in the field. For this edition, we were pleased to recognize work taking place in a country of great importance for us Portuguese. Brazil is a vast nation and presents as an enormous challenge to the organizations that are dedicated to helping the most remote and disadvantaged communities. The barriers of poverty and geography are some of the greatest in the world, and a truly exceptional effort is required to overcome them in the pursuit of healthcare. This is why the 2019 Champalimaud Vision Award recognized 3 of the most extraordinary eye care organizations anywhere in the world. The Instituto da Visão e Pepo, the Altino Ventura Foundation, and the Unicamp Ophthalmology Service do all provide essential support despite the challenges they face. The Instituto da Visão e Pepo makes use of telemedicine and other new technologies to provide optometry and tertiary eye care to a population of millions of people in the outskirts of São Paulo and beyond, namely in the Amazonian region. The Altino Ventura Foundation, based in one of the poorest areas of South America, in the northeastern part of Brazil, works tirelessly throughout the region to eliminate blindness and help the visually impaired, including caring for children affected by the Zika virus. And the Unicamp Ophthalmology Service initiated the first cataract-free zone in Latin America and promotes a true public health-based approach to treatment and prevention of blindness. Together, these 3 organizations have touched millions of lives and brought sight to communities which, without their help, would have nowhere to turn to. We at the Champalimaud Foundation are therefore extremely proud to have them as our laureates. The choice of our 2019 winners continues the successful path of our award in identifying the most deserving recipients. However, the success of our prize rests not just on the work of our winners, but on the efforts and expertise of our jury members. It therefore gives me great pleasure to offer my sincere gratitude to the chairman of our jury panel, Alfred Sommer. Al Sommer is both a celebrated scientist and a true humanitarian, whose brave work and determined science across the globe have left a profound and lasting impact on people and communities. He truly embodies both ends of the translational research spectrum that we strive to recognize through our Vision Award. He has been a central part of this prize from the very beginning and has ensured that the selection process is carried out with the highest criteria. He has also inspired myself and my fellow board members at Champalimaud Foundation in our commitment to global healthcare. I also owe a debt of gratitude to all our jury members. Our jury is composed by very distinguished scientists and prominent individuals in international development who spend many hours analyzing submissions and nominations and leave no stone unturned in their assessment of the candidates' achievements. May I single out 2 other jury members, Nag Rao, who is now being succeeded as chair of one of the most outstanding eye health organizations in the world, the LV Prasad Eye Institute in Hyderabad in India, which he created and who has been key in the development and expansion of the International Agency for the Prevention of Blindness and WHO's Vision 2020 Global Initiative, and Paul Siving, the initiator of the audacious goals, who recently left what was an extraordinary tenure at the National Eye Institute for a new position at the University of California. Together, Al, Nag and Paul helped design our award and establish it in the research and humanitarian communities. We at Champalimaud Foundation are deeply grateful to them, as to all members of our jury. We are also grateful to the many distinguished professionals who have acted as nominators or have written letters of support for our award candidates. Our prize and nominations rely intensely on the expertise and effort of many, many people around the world. Like everyone else, we at Champalimaud Foundation endured an unusual and difficult year in 2020. Our working practices and safety regulations had to be adapted quickly and efficiently to this new normal. In spite of that, we were able to keep offering the best possible treatments to our cancer patients and to keep advancing the different areas of our research. We strived to both keep safe and keep our energy for new projects. In particular, the preparation of our new building, the Botton Champalimaud Pancreatic Cancer Center, continued throughout 2020, and we will open its doors later this year. This represents a new frontier of work, not only for our foundation, but for the wider field of cancer research. It will be the first center dedicated solely to advancing the standard of care for this terrible disease. We are very hopeful that the coming years will lead to much-needed breakthroughs. It is fitting that the theme of this year's ARVO meeting is Revolutionary Eye and Vision Research. 2020 reminded us that revolutionary approaches in science can overcome even the largest obstacles. This desire to use science to fight disease and reveal new knowledge is very much what brings us here to the ARVO meeting each year. I am grateful to the ARVO board, as always, for their friendship and support. And I am also grateful to all of you for joining us here for this part of the program and for sharing the journey of our award. It is my pleasure, therefore, to open this year's ARVO Champalimaud lecture and to celebrate with you the achievements of three outstanding organizations. Scientific breakthroughs have, without a doubt, been the most important theme of the last month. In times of darkness, it is so often science that brings us light. That we have vaccines already available for a virus we were barely aware of just over a year ago shows what can be done when excellent science comes together with state support and global networks. And it is also a testament to the power we have in our work to shape the world we live in. What is new is that this old truth is today clear in the eyes of everyone. Let us build on this new reality and work fast to prove us right. Thank you.